Hello everyone and welcome to PhysioJo's Health Info. Today we are going to talk about the back. So call it back 101 if you wish. I'm going to give you some information about your lower back, or aka lumbar spine. But before we go into those details about the back, the reason why I want to do this video is because I find the more people know about the way your body works and functions, the better you can understand your pain and help treat yourself through exercises and tips that I give you to help make yourself feel better and get back into normal function. But before we get into the details of the back, there's going to be quite a few details. I'll try to give you as much information as I can while keeping it simple and not only show you anatomically what the back looks like, what all the individual parts look like, but what their job is and how injury to certain areas, what kind of pain that would feel like. The back is pretty complicated, so this might be a little bit of a lengthy one. I'll try not to talk too much. But I want to start off first by talking a little bit about physiotherapy. So I am one of those physiotherapists that's very, very proud to say that I am a physiotherapist. Most of the physios that I know agree with me that it's a profession that to be very proud of, because I find that we have a definite place within the healthcare system to help get people better. There's physios that do different things that come from different schools of thought, we call them. And you'll say that there are good physios like there are bad physios. Same way you could say that there are good doctors and bad doctors. There's good mechanics and there's bad mechanics. So know that we all treat a little bit differently. It's normal that not all physios will treat the same way. I've been a physio for 21 years, so I know that when I first started, when I was a new grad, what I had in my box of tools was not very much. Is whatever I learned in university, I gained more and made my box much bigger. I had a lot more tools as the years went on, and I did more postgraduate courses. But the more we have in our toolbox, the more we're able to help people that come in with different problems, and we learn from every person that we see. So that being said, you can go see a physiotherapist that'll do that'll do the modalities, which is ultrasound, TENS machine, IFC, interferential current, the mechanical traction units. I've used them for necks, I've used them for backs. Some have special courses like manual therapy. So I've done quite a few of the manual therapy courses myself. Our hands are probably our best tool, the best tools that we have to try and help restore function and movement in people. Acupuncture. So I do have my anatomical acupuncture course, and I've also done a traditional Chinese acupuncture course as well. I've done the cupping. So there's most of us physios that have years under our belt. We have quite a few tools in our box. The reason why I'm talking to you about this is I want you to know that's not the be all end all of how good a physiotherapist will be. In my opinion, the one that focuses a lot on education to make sure that you understand how your body works normally, how it works now that you've injured yourself, and what your injury is, definition, moving, showing you what it is probably one of the best that you can find. So education, look for someone who is very good at educating and giving you tips on how to make life easier. Now, of all the tools that I have used in the past, I'll be honest with you, with the older generation, so older adults, seniors, those are the people that I treat right now in the clinic that we have here at Finlandia. And I'll say that most of my treatments look like this: a whole lot of education, a whole lot of exercises, a little bit of hands-on treatment to help get things moving better, to just get the ball rolling, we'll say. And the one tool that I have to admit that I do use quite a bit is the heat with the fascia blaster. So connective tissue, I've learned in my years that the connective tissue can really, really impact how well our body functions. And it's really hard on your own to get that connective tissue to loosen up. But we have a tool that we use here that works really, really well for that. And I've had quite a few patients that have had successful treatments and programs thanks to that. So in a nutshell, that's it. But predominantly, it's education and exercise. Those are the two main things that I focus on. Now, I pulled up, so that's me. As a physio, that's what I do. A lot of education, a lot of exercise. I look and see how the body moves. I want to see posture, how you're standing. I want to see how you're moving when you're doing everyday activities. I want to see what your body looks like when you're walking, when you're standing on one leg, what your balance is like. And from there, I get a whole lot of information about what's going on, what muscles are at fault, and who's working too much, who's not working enough. And then I can usually devise an exercise program based on that. Now, I pulled up there's different definitions of physiotherapy. Some are pretty fancy, and some are pretty simple. I really, really like this one that I found that it doesn't really come from any particular source. I'll read it to you because I find that's truly what I feel physiotherapy is all about. So physiotherapy is treatment to help restore, maintain, and make the most out of a patient's mobility, function, and well-being. If you don't incorporate all of that, you might be missing the boat. Physiotherapy helps through physical rehabilitation, injury prevention, and health and fitness. So all of those things, I think we've actually touched on most of those things in all the videos, put all the videos together, and we've touched a little bit on each of those things. And physiotherapists, in my opinion, the good ones, are going to get you involved in your own recovery. So the good physios, the successful physios, are the ones that are going to educate you on what is going on so you can help prevent it from happening again when the pain is all resolved. And they're going to help you understand what's going on and how important why certain exercises are important. Not just say, here, do these exercises, but to explain why you're doing those particular exercises. And they're going to involve you in it, so you're going to be part of it. When I have patients come in, if I've given them some exercises and they come in for a checkup, let's say 2 or 3 weeks later, and ask them, how are things going? If they say there's been absolutely no change, I still feel just as bad as I did before, my first question is going to be, did you do your exercises as often as I advised you to? And if they say no, then I'm going to come right out and say, well, that's why you're not feeling any better. You're going to be wasting your time and mine if you come back and see me and you've not done any exercises in the meantime. Your pain's not going to magically go away. It didn't before you came to see me. It's not going to afterwards. If you come to me for advice, I give you education, I give you exercises. Now the power's in your hand. You do the exercises at home and you will feel better to a certain extent. I'm not going to promise anybody that I can make their pain completely go away, because I can't do that. But if you put the time and effort in doing your exercises and following the tips that I give you, then chances are you're going to feel a reduction in pain. Once that happens and we can reevaluate how your body's responding, then we can move on to some other exercises that'll get you even that much closer to full recovery. Okay, that's enough about physio. I'm passionate about my profession. I'm passionate about being a physio. And I truly, truly believe in the importance of education, exercises, and within the exercises is always keeping in mind alignment, like we talked about in the video yesterday, and posture. So posture, alignment. If you don't work on your posture and align everything before you start doing some specific stretching or strengthening exercises, you're not going to be successful. So all of our programs are based on that. Now, keep that in mind when we talk about the back. So I have a whole lot of people that come and see me for back injuries. And I also have some people that they're not necessarily coming to see me for the back. They're coming to see me for a knee or a hip that's very well degenerated into the moderate to severe stages of arthritis. And they're coming to see me for some rehab or prehab because they want to hopefully avoid hip replacement or joint replacement surgery. A lot of those people, once I start digging in and asking them more questions, we realize that they've had back pain for years, or they had a back injury 20, 30 years ago that they never really thought of, because you know what, it's always there. So don't think about it because it's there. If I think about it, I realize it's there, but I've learned to live with it. So chances are, like we talked about in the previous video, chances are that back pain led to some alignment issues, some muscle imbalances, and that is what threw the alignment off in your hip or your knee. And that is why years later you're developing pain in those joints, because they are pretty worn down. So that being said, with the program that I give the people that have knee and hip, that could potentially need hip and knee replacements, I'm focusing on the pelvis. I'm focusing on the lower back, on all the muscles that stabilize that area there. And quite a few, if not all of them, have noticed a huge improvement in their pain, to the point where some of them said, you know what, I can't see needing a surgery anytime soon. If I keep doing my exercises, I'm pretty sure that I'll be good to go and not need a joint replacement at all. So let's talk about the back. We can talk about those specific exercises at a later time. Today, I just want to explain to you what is in a back. What does the back look like? How does it work? How does it function? And why it's important to do those postural exercises we discussed in, I think, that one of the first few videos that we posted. Okay, the back, the spine. So I have here my little spine, a little, very small replica of a spine. But what you see here, this is the pelvis. Okay, so the pelvis is made up of 3 bones, an ilium on one side, ilium on the other side, and then you have the sacrum right in the middle. These bones will move. So if you're standing on the right leg and you lift and lower your left leg, this part is going to rotate, and that sacrum in the middle is going to stay stationary with this side. Same thing happens on the other side. But if you're standing on both legs and you bend forward, these guys stay put, and it's the sacrum that's going to be going forward and back in this position. So there is definitely some movement back here, and this is what we call the SI joint. So if you've ever seen a physio that I said your SI joint is not moving properly, or it's stuck, or you have issues with that SI joint, that is the spot. That's the joint that we're talking about. There's supposed to be some movement in there, so we try to help restore that through exercises or through some manual therapy and hands-on treatment. So what you see here, these yellow things on the side, are the actual nerve roots that are coming out of the spine. I'm going to show you with a photo that has a little bit more detail than this little guy, because it's not that big. Okay. So now I am going to see if I can flip this video around. Nope, I cannot. Okay, so then what we're gonna have to do is this. Okay, so here's your spine, okay? Looking at it from the front, and then from the side, and then from the back. So you see the bones are called the vertebrae. In between the vertebrae is what you call the discs. And the disc itself, if I flip the page, we're going to look at this page here, because this is the lumbar spine, so lower back. The disc here is kind of spongy in the middle and pretty rigid on the outside, and all the layers are kind of on top of each other, like diagonally this way and that way. And the reason for that is that when you're twisting side to side, you need to have them in different orientation so that it'll resist shearing and tearing. This is what your vertebrae looks like from the top. So the disc is going to be sitting just on this part here, one above and one below, like you see in this photo. Now, what I want to emphasize here is that the disc is stuck to the bone down here, and it's stuck to the bone there. So if ever you've been told that you've slipped a disc, that's improper information. A disc cannot slip, it can't move, it's stuck above and below. What can happen is that you can tear one of the outside fibers of that disc with one small twist or lifting something and feeling that stab of pain deep in your back. You could have a lesion, like an outer lesion of that disc, which will heal in time. The problem is that little lesion there that's now scar tissue will always be more susceptible to injury than, let's say, the rest of the disc or any of the other discs. So the next time something happens, like let's say after that initial injury, you didn't strengthen your core, you didn't work on strengthening your glutes or stretching some muscles that have gotten tight because of postural imbalances or postural issues, and the same thing happens, or another injury where you're twisting or lifting something too heavy and you get that shot of pain again. What could potentially happen is that this little tear will spread a little bit deeper. So now it's not just the outer rim, it's coming in a little bit more. And then the next time you hurt your back, it goes a little more and a little more and a little more. So a lot of people that have chronic pain or that have a disc herniation or a bulge will say that it was many small incidences, and then all of a sudden it was as simple as picking up a pen off of the floor that boom, gave them that shot of pain, and they were on their back for 2 weeks. So what happens is little by little that tear starts to go towards the inside. On the inside where you see the nucleus there, if there's contact between the outside and the inside, that's where you're going to have that spongy tissue on the inside start to bulge outwards, and that's what we call a herniated disc. So it's coming out. Where that is a problem, did I pull up a photo of that? Hang on a second. No, I don't have a photo there. But I'll show you in this next photo how that's going to be an issue. So imagine this disc here that's now sticking out like that. The purpose of a disc is to be like a shock absorber when you're standing, jumping, running, that kind of thing. But its main job is to maintain the opening of the space back here. So that is your intervertebral canal. That's where the nerve root is going to come out, as we saw on my little spine guy a while ago. So your spinal cord comes down the middle, and at every one of these levels, there's a nerve root that comes out. If there's a herniation here, you can imagine how it's going to restrict that space where the nerve is supposed to come out. And if you restrict that, or you compress that nerve with anything that's not supposed to be there, you could have some nerve-like symptoms. And that, like we talked about in the last video, will be pain, numbness, or tingling. If it's in your lower back, you're going to feel that down your leg. If it's in your neck, you're going to feel it going down your arm. If it's in your middle back, which is not that common, but if it is in your middle back, those nerve roots, they'll wrap around towards the front of your chest. Okay? I'm going to show you a photo in a little bit of exactly where each of these nerve roots go in terms of distribution in the skin, which is what we call dermatomes. We talked a bit about that in the video yesterday. I'll show you that next. But another thing I wanted to point out here is, remember in the video yesterday, we were talking about cartilage, and I was saying, give my hand a break. I was saying how cartilage is at the end of any two bones where the bones come together and form a joint. So in the front of the vertebrae, it's the disc that separates the two bones. There's no bone touching bone there. But if you look at the back side here, looking at it in this view is a little bit easier. These are the facet joints, okay? So the top joint of one vertebrae is going to connect with the bottom joint of the one above it. So right here, you've got two bones that are together, and you've got the two bones that are together there. The blue is cartilage. So there's going to be cartilage on this bone, and there's going to be cartilage on the undersurface of that one there. If you have arthritis in your back, that's where the arthritis is going to be. It's not in the front part. It's just right there in that joint. Now, what often happens with that, if you have arthritis of your knees or your hips, and you've seen the x-ray, you could see some new bone formation, bony spurs, things like that. Or you've seen an x-ray report of your back or somebody's back, and it shows bone spurs or osteophytes. What happens is, as the cartilage gets worn down, there's new bone that starts to kind of set in on the outskirts of the joint itself to try and help with the stability of the joint. And that can definitely lead to encroachment of that foramen as well. So the space where the nerve root comes out, that space can be decreased by either a disc that's bulging or herniating, or some extra bone spurs that are forming themselves because of arthritis in that particular facet joint. Now, before I go any further, I want to explain a little bit about the mechanics of the back. So what happens typically so pretend my hands like this are the facet joints. So those joints at the back where the arthritis is. When you bend forward, what's going to happen is those facet joints are going to open. So I'm bending forward like this. So this top bone is going to go up, and the other one underneath is going to stay there. So bending forward is going to open up that joint. What also happens when you bend forward is, if you imagine the disc in between these two bones, when you bend forward, the front of the disc gets compressed, and then everything gets kind of pushed to the back, and the back part of the disc gets stretched. So that's why a bending forward and twisting, or bending forward and lifting motion, is usually what's going to cause a disc herniation or a bulge, because you're putting a lot of strain. You're putting that disc in a position where there's the most strain on it. So that's where it's most susceptible to be injured, in that position there. So bend forward, your disc is going to be really stretched at the back, and you're going to be opening those facet joints. Now, bending backwards, the opposite's going to happen. So the back part of the disc is going to be compressed or smaller. You're stretching the front part of the disc, and you're closing those facet joints. So the joint that's like this, you're closing it down more when you bend backwards. You're opening it when you bend forward, you close it when you bend backwards. So in understanding that, it'll be easy for you to understand why typically, now it doesn't happen for everybody, but typically if you have pain, if your injury, let's say you have back pain and you're wondering, geez, what's going on? Is this a disc? Is it a muscle? Do I have arthritis in the facet joints? One easy trick, it doesn't work for everybody, but for the most part it does. If you have pain when you bend forward, but no pain when you bend backwards, chances are it's probably a disc that's been damaged or a muscle. If it hurts when you bend backwards and it actually feels good when you bend forward, it's probably the facet joints that are either not closing properly or you have arthritis there. So don't panic if you lean back and it hurts. You're thinking, oh, shoots, I've got arthritis in my facet joints. You may, yes. Or it may just be that they're not closing properly because of an injury to any of the soft tissue that's around there. And I will say right now, I don't know the statistics. I don't know the percentage, but there are actually quite a few people. They did a study a while ago, and I've seen it in practice as well. Quite a few people go for back x-rays. People who are in their, we'll say 50s and 60s, have gone for an x-ray of their lower back, no asymptomatic, no pain, no issues in their back at all. They've gone for an x-ray and their x-ray shows a certain degree of degeneration. So our body starts to degenerate, I think, at the age of 30, if not younger. So by the time you're in your 50s and 60s and you've had any kind of, oh, I hurt my back at some point, which I think most people have by the time they're even 40, you will have a certain degree of degeneration, but I don't want you to panic because of that. A lot of people have degeneration if you look on an x-ray, but no symptoms. So no need to worry. Okay, so in a nutshell, movement-wise, that's kind of going to give you an idea of what could be wrong. Next, let's move on to right here. So here's a good photo of, so this is the lower back with your sacrum. We've got the ligaments that are attached in the back and in the front, but it shows the nerve roots where they come out in between each. So you see there's not that much room for that nerve to start off with. So it wouldn't take much of an extra little piece of bone there or your disc to be bulging a little bit towards the back to compress that nerve. And if you look on this photo here, look at this guy, you'll see that. So what they've done here is they've taken the back part of the spine off altogether. So there's no bone there. What you're seeing is the spinal cord and all of the nerve roots where they come out, and it kind of shows you where they go. So in the neck here, you can see that they all come together, they bunch up into the brachial plexus, and they're going to go down into the arm. Here, mid-back, they wrap around along the rib and they go towards the front, and then the ones in the lower back and coming out of the sacrum are going to form the nerves that go down into the legs. And if you see any writing, pen writing above the words in this book, this here, The Atlas of Human Anatomy by Frank Nitter, was my Bible in university, and actually still as a physiotherapist, I use this book all the time to show people how their body is made and why certain things are bothering them. And I actually did my program in French, so a lot of these words that I put in there are the French terms, so that when I was studying, I would be remembering the proper term for my exams. Okay, so we said a while ago that every nerve root that comes out is associated to a specific, what we call dermatome. A dermatome is a patch of skin where that nerve, the superficial or the sensory nerve, goes to. So if you have compression of the nerve in that particular point in your back where it comes out of your spine, you should have numbness or tingling or pain in that, or more numbness and tingling in that particular patch of skin. So that's one way for us to know at what level the nerve is getting compressed. So we'll check the dermatomes, the skin, check sensation, see if it's the same one side versus the other side, usually just with light touch. And then we'll also check the myotomes, We're not going to get into details on that, but it's every one of the nerve roots is associated with a key muscle. So if I test the muscle that is specifically linked to that nerve root and that nerve root's being compressed, there should be a significant weakness, a progressive weakness in that muscle when I strength test it compared to the other side. And then reflexes are another way. So there's 3 ways that we can test the different nerve roots to see where that compression is happening. So it's easier for us to pinpoint our treatment, especially our manual therapy treatment, to try and ease pressure on the nerve at that area. So here is a diagram of those dermatomes. So you'll see there all the different nerve roots. So the nerve roots are going to be called C1, 2, 3, and then your T's, and then your L's and your S's. Okay, so depending on what nerve root is being compressed, that is where you would feel sensation, a different sensation on the side where that nerve root's being compressed. Okay, now what's next here? Muscles. I wanted to show you guys as well where is it? Right here. Okay, where the nerve roots come out in the lower back, just to show you how complex it is here and how you're going to see what is the most common nerve that people complain about that is being compressed, that gives them pain, that is almost a household name in people who've had back problems for a long time? Sciatica. So sciatica means pain caused by the sciatic nerve. I think because I'm noticing my video is already 26 minutes long, I'm going to talk about sciatica and the other painful, like what could be causing sciatica. I think we'll do that in the next video. It's going to be too long to do it today, but I'm going to show you now because we've got the diagram. So if you look here where it says the sciatic nerve is going to be receiving. So the nerve roots, where it comes out of the spine, it'll come out from here, but it'll then branch off into a bunch of different segments that will then form different nerves that go into the body. So the sciatic nerve takes innervation from L4 right down to S3. L4, 5, S1, S2, S3. So 5 different areas, 5 different nerve roots will come together to form that sciatic nerve. Not surprising, because look at how big it is. So you could have an issue with any one of those 5 nerve roots and have sciatic type pain. So sciatica is a very broad term that is used quite a bit, but I'll try and explain it to you a little bit more next time, because there's 2 major causes of sciatica, and one is a lot less scary than the other one, we'll say. And what else did I want to show here before we're done for the day? That I'm going to show next time when we talk about sciatica. This I just wanted to show, I think this is my last one. Yeah, I just wanted to show the muscles of the back. Okay, so you've got discs that could give you problems in your back. You can have the facet joints that are worn down. What holds those facet joints together is the ligaments, the capsule, everything that holds it in place. But then you also have a whole lot of muscles. There's a lot of little muscles that go like intervertebral, that go from one segment to the other, that will initiate rotation. There are so many different layers of muscle in the back that it could be any one of those, and so many muscles, like we talked about yesterday, will do more than one job, that it could be complicated, but we could make it, sometimes we think of it more, that it's more complicated than it really is. So just looking here, I'm not going to go through all of them because that could be a whole lecture in itself, but here's a photo of your back. So here's the most superficial layer. They haven't taken any pieces off. Here's your latissimus dorsi, very big low back muscle, the most superficial, and it comes up into the arm, and it'll do internal rotation and extension of the arm. Here's your trapezius, another huge muscle, takes off from the base of the skull, comes across down here to your collarbone, comes along the backside of the shoulder blade, across like this, and then comes down. So it's separated into 3 parts. We call it upper, middle, and lower fibers of trapezius. Very, very, very important postural exercise. And we talked a little bit about this when we were talking about in our posture video. Take those 2 muscles off and you have all of these guys underneath. Now this big bundle of muscle that's under there is in itself, you can see on the next page, is in itself a big bunch of muscles like that, one on top of the other. And then if we want to go even deeper than that, you've got all of these little ones that go from one segment to the other, like I said before, that will initiate rotation. So the reason why I'm showing you all these muscles is that I have a lot of people that come into me and say, oh my God, like I must have slipped a disc. My doctor thinks I slipped a disc, or I did something to a disc for sure, because I was on my back, laid flat for a week. There are so many muscles in the back, and so many of these little muscles that just looking this way will engage that muscle in your lower back, that even though the pain is excruciating, know that it could be a muscle just as well as it could be a disc. And there's no way that myself or you or your doctor will know if it's a disc injury that you have unless an MRI is done. That's the only thing that's going to show if there's an injury. On an x-ray and a CAT scan, we will be able to see the bone. We'll be able to see the space in between the bone, and that's how we'll be able to say if the disc itself is unhealthy. If the space is the way it should be, like evenly spaced between each of the bones, then we know the disc is fine. If we see the space is smaller at one level than it is compared to the other ones, then there's something wrong there. So it could be a bulge or a herniation, but like I said before, only an MRI will confirm that. Or it could be that, due to previous injuries, that disc is degenerated. So another bad thing about having a disc injury is it's gonna heal, yes, but the more you do it, the more injuries you have to your back, not only are you going to increase the risk of it becoming from a small lesion on the outside to a full lesion going right to the nucleus and causing that herniation, but also it's going to be predisposing you to degenerative disc disease. So it's where the disc is getting smaller and smaller because of the repetitive injuries that are happening to that area. So all of that to say, you got to take care of your discs. You got to take care of your backs. And if you don't, then you could end up with some serious back pain and difficulty doing your everyday activities. Now, also in saying that, there is hope. There is, what's the word I'm looking for? I will say there's hope. Because if you strengthen your core muscles, if you work on realigning your spine, realigning your pelvis, and your weight-bearing joints of your legs, you are one step further ahead in not only having relief of any back pain that you have right now, but preventing your discs and facet joints from degenerating to the point where you have constant pain all the time. Alignment, alignment, alignment. So posture is the number one thing. Start doing those postural exercises. If by doing the postural exercises, you're noticing, yeah, you know what, it did help to a certain extent, but now I'm kind of stuck at that 4 out of 5. I was 7 out of 10. I was 7 out of 10 before I started doing the postural exercises. Now with all the videos you're doing, Joe, and the exercises that you got us to do, I went from a 7 to a 4. That's awesome. But I want to go down to like a 0 or a 1. What else can I do? In all the videos that we're doing now, I'm hoping I can give you little tips and things that you can do at home. If you're noticing improvements, fantastic. If it's not to the point where you want it to be, you may need to have a one-on-one consult so we can see exactly what's going on in there and give you some specific exercises. It's really hard to be specific for all the different conditions that are out there, but for as long as we're on COVID outbreak, on COVID alert, pandemic alert, and just being careful with our social distancing, I have time to provide you with this information. So I'm going to talk about sciatica next. We're going to do a couple of other videos with some exercises and just fun things as well, not just talking. And then if there's anything else you want me to talk about, please just let me know, either by sending me an email, jmckee@finlandiavillage.ca, calling and leaving a message on my extension. So call Finlandia Village and ask them to leave a message for Joanne, the physio, or PhysioJo. It's extension 272. Or you can even leave a comment at the bottom of this video or any videos on our YouTube page or YouTube channel. And I can tackle that and give you guys a video for whatever you want to know. Okay, almost 35 minutes. That's plenty. I need a drink. of water. And I hope this back information was good, that you learned something. That's always my goal, is that you learn something new every day when I'm here talking to you. And then we'll talk about sciatica very soon. Okay, stay tuned. Bye. Stay safe, have fun, and stay fit. Keep active.